Dr. Jim Orvick from the Oregon Pet Clinic is here, taking your calls at 270-9933. Staying cool?
Oh, sure.
Keep the animals hydrated and
Yeah.
out of the sun. One more day.
Yeah, one more day when we'll
worry
be
about
trying
the
to
snow
stay warm.
and the salt. Let's get to the phones. We'll start with Lori in Stoughton. Hi, Lori.
Hi, good afternoon.
Hi, what's your question?
My question today is our golden retriever has this terrible habit of licking people.
Mm-hmm.
It's not like just a hello, how nice to see you lick. It's just continuously licking.
Mm-hmm.
And we don't know what that's all about.
Well, it's a habit that some dogs have. My son has a dog that likes to lick everybody too.
Really?
Yeah. And I used to think, well, it was the salt on the skin or something that they like the taste of, but I think they're just being friendly, especially a golden retriever. They're extra friendly.
So,
and that's just that one's way of showing it, I think.
could you do some behavioral stuff?
Oh, yeah, I'm sure that trainers would have ways, or you could try a little, bad hot
Like
sauce on
Tabasco or something?
Try to break them of that habit, but that would be the
It's kind of a nice thing, but it's apparently annoying. But,
after a bit, I'm sure it is a bit annoying.
but no medical issue.
I don't think so, no.
All right, let's go to Marie in Wanakee. Hi, Marie.
Hi.
Hi.
I have a 16-year-old cat that has developed diabetes and has been on insulin for about 4 months. And I guess I'm wondering what the progression of the diabetes is in a cat and how does it affect the rest of her body?
Well, diabetes in cats is the same as in humans pretty much. As far as progression, cats are different than dogs and us. Sometimes they get over it. All of a sudden they're not diabetic anymore. Or it could just stay constant. There's no reason why it should be the cause of the end of the cat. As long as you give the insulin, and they seem to tolerate everything well, and I've had them live 18, 20 years as diabetic cats.
So that's not going to shorten their lives per se.
Should not shorten their lives as long as you
Stay
keep
on the
up
insulin?
with the insulin. Yeah.
All right.
And check often because they might not need it after a while.
All right. Linda in Madison. Hi, what's your question?
Hi, I acquired a 4-year-old rescue dog who has like the third eyelid that had come up I'd never seen before. My vet treated him with an eye drop. We thought it was an eye infection. That didn't do anything. Then he thought it was an allergy, so he took some allergy pills for a while. That didn't do anything. Now, someone told me the other day it could be like a food allergy. Is that a possibility?
If it is 1/3 eyelid that is up, then no, probably not. I would check the size of the pupil in that eye because there is a thing called Horner syndrome where the pupil dilates and the third eyelid comes up, and it's a neurological thing. The other thing is there's this gland of the third eyelid that'll get swollen and cause this, what they call cherry eye, and there are different corrections for that, but that has to be corrected surgically generally. But if it's just 1/3 eyelid that's staying up, either there's some irritation behind that eye, not an allergy to everything else, or it's neurological and needs to be looked into.
Okay. Lisa in Oregon. Hi, Lisa.
Hi, how are you today?
Good. What's your question?
We have a Cocker Spaniel, a female, and we're having a problem finding her heat cycle because she keeps herself so clean. Mm-hmm. And I'm wondering if there's another way to figure out when she's having it.
Other than the discharge?
Right.
Well, swelling. Do you?
Okay.
All you have to do is pick up her tail and note how she is when she's not in heat, and when she gets close to being in heat, the vulva will swell up a lot. It'll be 3 times normal size. So that would be the quickest, simplest, surest way.
All right. Check with the male dogs in the neighborhood.
Well, yeah.
They'll let you know.
They'll tell you.
All right, if you're on the line,
break
stay
the
there.
door down.
Jim will take your call off the air. Good to see you again. We'll see you in a month, and we'll be right back with a final check of your forecast.